And now to some more on our second leading story this morning. Registration of an Ebola vaccine is expected in additional countries in the coming weeks as the Democratic Republic of Congo, DRC, Burundi, Ghana and Zambia give license just 90 days after the World Health Organization, WHO's pre-qualification. So what does this news mean in the global fight against the hemorrhagic disease? Well, first, the licensing of the vaccine means that the manufacturer can stockpile and widely distribute it to African countries at risk of Ebola, that is the Ebola virus disease outbreaks. Once licensed doses are available, use of the vaccine will not require a clinical trial or other research protocols. Bridget.
Exactly, Jerry. The first experiments began in 2015 during the epidemic in West Africa, where the number of victims exceeded 11,000 people. The vaccine has also been administered in the DRC in a targeted manner since the resurgence of the virus in August 2018. Already, 290,000 people have received it preventatively in the most exposed areas in the east of the DRC. The vaccine is to be used as part of a study on the disease. Beneficiaries will first have to give their consent and be followed for several weeks.
With us now is Dr. Michael Yao. Dr. Michael Yao is the WHO's Emergency Management Coordinator for Africa. Dr. Yao, a pleasure to have you with us this morning from Brazzaville. Thank you very much for joining us. So let's start off from this. Concretely, can you tell us, what does this announcement mean?
Well, it means that these countries were in fact giving permission for these drugs to be marketed and used can be done without the use of research protocol, because these are the frameworks that these drugs and vaccines need for research purposes in order to respond to an epidemic or to control it. So this is the major advance that has been recognized by several countries, such as the United States, or some of the companies that manufacture these vaccines, which are located in Europe. It is important that certain African countries can be able to authorize it as well, because it facilitates its use in the event of an emergency epidemic. So do you hope that other countries will follow the path of the 4 countries that have accepted? Well, we have been fortunate, despite difficult conditions, to have tested the effectiveness of these vaccines, particularly the side effects. And as a result of this massive use, we have more than 280,000 people vaccinated, which is a precedent for the experimental use of a vaccine. The conclusions of this research have therefore made it possible to license this vaccine in the US and also by the competent structures of the European Union, and this is why this vaccine can now be manufactured here in Africa. But in order for it to be used within the continent, it's absolutely necessary that the next step for these countries is to be able to license this vaccine according to their own regulations.
So, Dr. Yao, at the moment we have on our hands another epidemic, and this is where the attention has gone to lately. Where would you say we are really in terms of the Ebola epidemic, particularly in the DRC?
Well, the countries should indeed take this step, because you never know when there will be an emergency, when there will be an epidemic, and when we will need to use these vaccines. Licensing also encourages manufacturers to be able to do this, because it means the vaccines can be stored, can be processed, and be sent to several countries. So these are the steps that are very necessary in terms of preparation, and it's also necessary to enable us to encourage the manufacturers to make this vaccine available, and that is something that's important for the continent.